Warm greetings from New York and welcome to today's webinar of Konrad Adenauer Stiftung addressing the Nexus of Health and Security. I'm Andrea Ostheimer, the director of the CAS office in New York, and I will also be your moderator. In our discussion today, we want to focus mainly on three aspects. First, early warning. COVID-19 hit the international community unprepared. Irrespective of the fact that a variety of global risk analysis as well as national security strategies cited pandemics as a likely risk scenario for forthcoming decades. Another point we want to address is crisis management. The velocity with which the virus is spreading around the globe and in communities dwarfs any attempts for mere national responses. As the example of the US sadly illustrates, it challenges well-developed and rich countries. And in developing countries, it puts a strain on fragile health systems. And in those regions affected by conflict, the pandemic exacerbates the suffering, as we see with the dire humanitarian situation in Yemen, for example. And third, we also want to address the resilience of societies. The impact of COVID-19 on health systems, economies, and the fabric of societies underlines the need for comprehensive responses cutting across all sectors. What is needed is a human security approach that strengthens not only early warning systems, allows for coordinated crisis management, but also enhances the resilience of societies in the mid and long term. So the aim is really to build back better. Certainly, these are three very complex aspects of the pandemic, and we are honored that we have today with us four eminent experts on public health, on global as well as on national level. But before I introduce our panelists to you, let me just give you some housekeeping rules. Your microphones will be muted. If you would like to make a comment or you have a question that should be posed to one of the panelists, please write it into the question and answer section. Indicate your name, affiliation, and to whom it is addressed. Dr. Tom Frieden only has 30 minutes with us, so if you would like to direct a question to him, please do so as soon as possible. The discussion is a public event and will be recorded. In case you miss a part of it due to other obligations, you will also find it on the YouTube channel of Konrad Adenauer Stiftung New York. But let me introduce now our experts. Hermann Gröhe is a member of the German Bundestag and served as Minister of Health from 2013 to 2018. As Mr. Gröhe is also the Vice Chairman of Konrad Adenauer Stiftung, we initially had planned at the beginning of the year to have a panel discussion on the nexus of health and security during the German presidency in the Security Council. I think nobody would have dared to imagine that COVID-19 would change our lives and societies so dramatically, and that the topic would become more pertinent than ever. Hermann Gröhe has been very engaged during his tenure as minister in the fight against Ebola. Together with our Chancellor Angela Merkel, he put the topic of pandemics high on the agenda of the G20. And in 2016, Hermann Gröhe has also been appointed by UN Secretary General Ban Ki-moon to the High-Level Commission on Health, Employment and Economic Growth. Thank you, Mr. Gröhe, for spending your evening with us. It would have been a pleasure to welcome you as originally planned in New York, but I hope that we will have other opportunities. Ladies and gentlemen, the World Health Organization is at the front line of crisis management, information and coordination during COVID-19. Therefore, we feel honored to have with us the Assistant Director General for Emergency Preparedness and International Health Regulations, Dr. Jawad Mahjour. Dr. Mahjour is a public health specialist with over 30 years of experience in designing, implementing, and evaluating diseases control programs at national and international levels. He joined the World Health Organization in 2005 and worked in various functions for the organization on director level in its Eastern Mediterranean regional office, as well as at head office in Geneva. Thank you very much for sharing your expertise and time with us, Dr. Mahjour. As CAS, we feel very strongly about supporting multilateral organizations and giving them a voice. Thank you very much. It is also a pleasure for me to introduce to you an expert who certainly in the US does not need much of an introduction, Dr. Thomas Frieden. Dr. Thomas Frieden served as director of the Centers for Disease Control and Prevention from 2009 to 2017. He also became internationally renowned through his fight in ending the Ebola epidemic in West Africa. Before he joined the Obama administration, he had been Health Commissioner of New York City from 2002 to 2009. Dr. Frieden has founded and serves as the CEO of the humanitarian organization Resolve to Save Lives, an initiative to prevent epidemics and cardiovascular diseases. Thank you, Dr. Frieden, for accommodating your tight agenda for us. We really appreciate that. And last but not least, our fourth panelist is Nana Tawunaku, Senior Health Advisor in the Executive Office of the UN Secretary General. Nana Tawunaku is a development economist and public policy specialist by training. She has over 17 years of experience in global and public health, rural development, and in the fight against HIV. Prior to joining the UN Secretary General's office, she worked for UNAIDS and served as country director in China. Currently, Nana works with UN Secretary General Antonio Guterres on the pandemic. She's providing policy and technical advice on global health, but also on other topics such as education, food security, and she has also between 2013 and 2018 be the manager of the UN Global Campaign that engages governments and private sector and civil society in the fight to support every woman, every child's health. So thank you very much, Nana, for sharing your time with us. Ladies and gentlemen, coming to today's topic, UN Secretary General Guterres has highlighted very early on in the pandemic the nexus of health and security, and he had called for a global ceasefire. When Antonio Guterres briefed the UN Security Council in April on the impact of the pandemic on peace and security, he elaborated 8 points which are destabilizing international peace and security as they are exacerbated by the pandemic. And he highlighted the importance of trust of the population in the crisis management capacity of their governments and the prevalence of mistrust in many instances. So Mr. Grö, you are a former Minister of Health and now also a member of the German Parliament. From a politician's point of view, how can public trust in government policies be established and also maintained within a crisis?
Thank you very much, Andrea Ostheimer. Let me first thank you, Andrea, for bringing us together, even if not physically in a conference room, but in that form of a webinar, and give me also the opportunity to say a special word of hello to Tom Frieden. We met some years ago, first in Switzerland, later in the US, and I appreciated your leadership during the Ebola crisis, when CDS was really crucial for being the important instrument on the ground, and at the same time you had a very strong multilateral approach. I think this balancing out American leadership and multilateral approach was your brand during that crisis some years ago. And to be frank, this balance of leadership and multilateral approach, of course, is missed very badly now, but it's a great joy to see you again, Tom. And I remember quite well, for example, a meeting with Jim Kim and Margaret Chan and others when you gave the report on the status on the ground in West Africa. Concerning the question of trust in government, I would say a crisis is a moment of truth, because whether you have the trust of your population in a crisis depends mainly whether there was needed trust before. In Germany, I would even say, to be frank, that we have an increase of trust. We have a chancellor now for 15 years, and it's quite normal that in easygoing times, people would say, oh, let's test something new. But if that's, we saw 1 year ago that the polls were not so happy for us at the party of the chancellor, but in a crisis and in serious time like we have now, people that tend to trust this chancellor become more and more. So the polls for the party of the chancellor and her personal polls increased instead of decreasing because of the challenges ahead. And I think there are two other reasons I would like to mention. The first is the balance between the unity, party lines crossing in the beginning, but then again having the normal situation of controversial debates in parliament. In the beginning, we had that situation that all parties besides the right-wing populists tend to say, we want to go in a party uniting answer. But after a while, when we debate about the measures with the lockdown, whether they are restrictive, too restrictive, not restrictive enough, it's good that we have now again normal controversial debate in parliament, because otherwise those that tend to look for conspiracy theories and others would say, oh, there is that monolithic block in the political class. They will give only one direction and we need to go in opposition to that. So I think it's balancing out unity and needed debate. And the last thing is the role of scientific advice. I would say we are happy that many important institutions in Germany, of course, all of you know the Robert Koch Institute. Tom would know Lothar Wieler, the president of Robert Koch Institute, and those people giving regularly briefings, and they are seen with the chancellor, with the minister presidents, with the parliamentarians. And I would say, generally speaking, besides some shocking fans of conspiracy theories, a lot of Germans like to see that the government is following scientific evidence. They have to learn, if it's a new challenge like the pandemic of COVID-19, that there is not one single opinion within all the researching community, that there are also controversial debates between scientists. And that's not so easy if you want to follow them. And some people are struggling with that, but generally we have a very strong trust in the scientific capacities. And so that helps a lot, that a political authority that gave room to scientific evidence is accepted by the population. So I think these are some of those aspects that maybe answer your question.
No, thank you very much, Mr. Grue. And I think the catalytic effects of the pandemic have been exposed in all sectors of society, and certainly are one feature. I would like now to come to Dr. Thomas Frieden. One aspect we would like to address today is also the resilience of societies against pandemics. And the question really is, what should we have known and in place actually in order not to become totally overwhelmed by COVID-19? What is your take on that? Would it have been possible to be better prepared?
Well, first off, it's a delight to be here with you. And Hermann Grohe, I also remember our meetings in Geneva and New York. And I've been so impressed. I had a very good relationship with the RKI when I was at the CDC, and been so impressed with the German response. In fact, I just came from another webinar where we were looking at exemplars of global health, and Germany's response is really the positive outlier in Europe. If the US had Germany's death rate, we would have 2/3 fewer deaths in the US. So really important. And I guess I can think about some principles and some specifics. One of the key principles is to base decisions on data. And as was just being said, you have to level with people. We don't know all the answers, so we're going to share what we know when we know it. And that kind of communication is crucially important, and that reliance on data. Second principle is we have to use everyday systems. We shouldn't think of epidemic control as like you break the box and open up the fire special equipment and then put it out. No, it doesn't work that way. It works if you have an everyday system that's functional, that you can then scale up because it's robust. You have to be able to address both the infectious diseases and the non-communicable diseases, because if we have obesity, diabetes, hypertension, heart disease, kidney failure, all of those things make our society less resilient. And you need political leadership. And you know, it's been noted that governments led by women, have done better, quite reliably, whether it's Angela Merkel or New Zealand, or many, many other places, including states around the US, some of the best performing. And there are two theories for why that may be. One is that women are simply better at listening to advice and not having to put their own ego forward. The second is that in order to be a woman and elected to highest office, you have to be better than the average man elected to the highest office, because there's still sexism in our system. And I mentioned that to the woman who runs our COVID response, and she pointed out immediately to me, you know, those aren't mutually exclusive theories. They're consistent. But in addition to the principles, I think there's specifics of what we need to do. You need to have an enabling environment. That means law, that means regulation, and that means funding. You need to have a laboratory system. The labs are usually the poor relation, and we've seen this all over the world. It's really suffering for this. And the US CDC stumbled on this early on, but so did other parts of the US. And at this point, with so many cases in the US, it would be almost impossible to keep up with testing. You need real-time surveillance. In public health, surveillance is the lifeblood. So you know what's happening and when. So we see when there's an uptick anywhere. You need a workforce. You need people who are disease detectives. And there are wonderful stories from Germany of a really meticulous contact tracing to the level of identifying in a factory that when one worker passed the salt shaker to another worker, that's how COVID passed. So you have really good disease detective work. And you need preparedness plans. So you need to be ready to scale up. And you need rapid response teams. Speed is so, so important. An hour, a day, a week can make all of the difference. Here in New York, sad to say, if a week or two earlier we had shut down, there would have been half or less than half as many deaths. The disease was just exploding here, and yet because of a failure of testing, it wasn't apparent. And because of that, we had really a devastating situation in New York. We had 25,000 deaths in the course of a couple of months, compared with a full year, all causes 54,000 deaths. So just an astronomically high death rate. And perhaps crucially important is risk communication or effective emergency communication. There are CDC principles on this. Be first, be right, be credible, empathize, give people concrete things to do. And that's crucially important. And then, of course, we need resilient communities that are healthy communities. If there's any part of society that's alienated, that is where disease can spread without anyone knowing or being able to stop it. Whether that's dormitories for migrant workers in Singapore, or some ethnic minority populations throughout Europe and in the US, where we have shockingly high rates of premature disability and death in African American, Native American, and some Latinx, Hispanic communities. So the virus will exploit any weak point in society, any vulnerability. And that means shining a light on and lifting up those parts of society that are unfairly treated. It also means identifying how we can reach into those communities, identifying leaders, strengthening those inherent leadership in the community, so that it's not just community education, which is very top down, but a community empowerment and community leadership to be able to respond effectively. And all over the world, we're seeing this as a very important lesson to be learned and emphasized.
Okay, thank you. You mentioned the need for political leadership. Mr. Grö already lamented the lack of leadership on global level. During your time as director of the CDC, you have been at the forefront in the fight against Ebola, and contrary to the recent controversies around the UN Security Council resolution on COVID-19, it was in fact the Security Council that got united in 2015 and passed UN Security Council resolution 2177, addressing the Ebola crisis in West Africa, and also authorizing for the first time a medical UN mission. How can solidarity amongst UN member states be enhanced? If you look back at the experiences that you had in 2014 and 2015, and would you say there is a need for the demonstration of global leadership by key actors, and where would it come from?
Well, I'll respond structurally. The United Nations has enormous strengths and also weaknesses. And for any individual or organization, usually your greatest strength is also your greatest weakness. The fact that the United Nations represents every country in the world means that the countries of the world have a sense of ownership and buy-in to what the United Nations does. And that is true also for the World Health Organization. But that also means that it's sometimes difficult for the United Nations to call out one member or to act with the speed needed in an emergency. And I think what we must do coming out of this terrible pandemic is strengthen WHO, double down on our support for WHO, but also look carefully at several fundamental gaps we have. One of them is clearly early warning systems. We do not have adequate early warning systems around the world, and I don't think those are going to be supranational. I think early warning systems are going to be national, but there are some ways we can have common goods, like you have weather satellites. There's some ways that can happen, but fundamentally, I think over the past 3 to 4 years, the world for the first time has taken stock of where we are with preparedness. The assessments aren't perfect, but they're the best we've ever had. And we now know for more than 110 countries in the world, and Dr. Majur can discuss this in even more detail, not only how prepared they are, but where the gaps in preparedness are. We've identified, we, the world, WHO, identified more than roughly 10,000 life-threatening gaps in finding, stopping, and preventing disease spread. And over the last few years, we've figured out what it costs to fill those gaps and how those gaps can be filled. What we haven't done is invested in filling the gaps. And there are 3 core weaknesses. One, we don't have the money. And the need is probably on the order of $10 billion a year for a decade. Now that's a huge amount of money, and it's a drop in the bucket compared to what it will prevent. So we have to invest wisely. Second, there needs to be very strong technical support for countries. And this is something we have to learn from successes and weaknesses of other global health initiatives. That technical support has to be of the highest quality, very rapid. And third, the managerial or operational capacity in countries needs to be increased. A lot of times it is really about management that makes all the difference. Even if you have the political will, even if you have the money, even if you're doing the right things, if you can't manage them well, it's not going to happen. And low resource countries are not low resource only in money. They're low resource in trained human beings. And it's not because people are any less gifted, talented, dedicated, intelligent. It's because they don't have the support, they don't have the training to manage effectively. So one of the things that we've begun to do is management training as part of epidemic prevention. But globally, I think as a world coming out of the COVID pandemic and going through the COVID pandemic, because it's far from over, we need to establish a global mechanism to strengthen preparedness in every country of the world. Because if there's any weak link, all of us are more vulnerable. And Germany is uniquely positioned to support that, given both its role as a multilateral supporter and its effective response. So you have a lot of credibility and there's a lot of need. There's going to be a lot of complex discussion about this. It's not about trying to undermine or sideline WHO, quite the contrary. We want to see increased support for WHO, but we have to see what can we do, because there's an old saying in our country, at least, if you keep on doing what you've always done, you'll get the results you've always gotten. And if we keep on doing what we've always done, we're going to limp along and not really make the world a safer place. It's inevitable there will be another pandemic. What's not inevitable is that we will still be so woefully underprepared. I'll stop there.
Thank you. I have one question for you from Wesley Wark from the University of Ottawa. He would like to learn a little bit more on how to build those national systems of early warning and the role also intelligence services might play in it.
So I'm interested in epidemiologic intelligence, not kind of the cloak and dagger intelligence. And there are a few ways to do this. First off, you need a laboratory network. You need a warning system. It's like a smoke alarm system. So there are ways to ensure that you have reporting of diseases from around the world. Now that means that you have to have some primary care systems in place as well, or at least community health workers who are able to report if there are a bunch of new severe pneumonias. In fact, China has such a system. It's called SARI surveillance, S-A-R-I, severe acute respiratory illness surveillance. Every country in the world should have that. There are also death surveillance systems. One of the shocking gaps in our world knowledge is that we don't really have much information about who's dying where and from what. We don't know the death rates for most countries in the world with accuracy, nor do we know the causes. And one of the things that we're trying to do is increase rapid mortality surveillance weekly for COVID-19. This will be really important in identifying not just COVID, but COVID-associated deaths, not from the infection, but because people aren't going in for care, whether it's heart attacks in Brooklyn, which is what happened here, or malaria in Burkina Faso. So you need early warning systems, and that can be laboratory-based, community health worker-based, mortality surveillance-based. And then there's some newer mechanisms. So we've worked, for example, with Carnegie Mellon University and Facebook on a data feed that's very interesting because billions of people use Facebook, all voluntary opt-in. Would you answer a survey on how you're feeling today? And if you optimize that system, that could be interesting. You've got Google searches as an example. When people are searching fever, maybe there's an outbreak somewhere. You've got news trackers. So you've got websites that track possible outbreaks. There are various ways to do this, but there's no shortcut to having not just the early warning system like the smoke alarm, but also the sprinkler system to put it out quickly, to find it where it emerges, stop it quickly, and prevent it wherever possible. Think of the world as a building. If some of the rooms in our building don't have a sprinkler system, don't have an alarm system, the rest of our building is at risk. And that's the situation that we're in today. Now, in terms of intelligence services, I do think there's some areas we need to look at more carefully. Laboratory safety, for example. Sad to say, it's getting pretty easy to make really nasty germs in a lab. And I think there probably is a role for cutting back on that because there's just too much risk of an accidental or intentional release. And then if there is the possibility of criminal behavior, you need to have a coordination between the health and public security systems that's appropriate, that follows standard procedures. We did this in New York City after 9/11 and after the anthrax attacks. We arranged for a very clear memorandum of understanding between the police, the health department, and the Federal Bureau of Investigation, so that if there were something suspicious, it would be appropriately investigated. That's something of a long answer, but the bottom line here is that surveillance is our early warning system, and there's no shortcut to strengthening the capacity of countries, particularly throughout Asia and Africa, where it's very weak now, to know what diseases are emerging, what people are getting sick from, where lab networks are, what the death rate is, and how that's changing on a daily or weekly basis. And that's one of those things that's going to require that investment of something like $10 billion a year for about a decade to get the world to a much safer place.
Okay, thank you very much, Dr. Frieden. I know you have a very tight agenda. You already have to leave us for the next webinar you are engaging in. Thank you so much for sharing your insights and your expertise. It was a pleasure to have you. And I hope we will continue also the exchange on the topic at a point in the future. Thank you.
Thank you very much. All the best.
Thank you. I would like now to come to the role of the World Health Organization, which particularly in the context of early warning plays a key role. And Dr. Frieden just stressed the gaps that exist in the early warning systems. Dr. Majur, in your task, you also rely and depend very heavily on member states and their cooperation. So from your own experience and from your point of view, how can we strengthen those early warning systems for pandemics on national, regional, and global level? And also looking at the global level, what would be needed to enhance the capacity, be it in Geneva, be it in New York?
Let me first thank you, Chair, and for inviting WHO to contribute to this very important and timely discussion. And also for me, it's a good opportunity to thank Germany for their support to the global health and to the WHO work, everywhere in the world. I think Mr. Gore and Tom Frieden put the scene for discussion, and I would like to come back to some very important issues that was raised by Tom on emergency preparedness. Today, we have the right tool to assess country capacities, although they need to be improved. We have clear idea about the situation in each country and what are the gaps and what should be done. What is missing is resources, human resources and technical support and financial resources to make this happening in the field. One other comment on what you said, Madam Chair, on WHO is relying on official reporting. WHO, of course, receive information from countries in official way through the under the IHR 2005, but we also screen all information published, and we do that 24/7. Information published by the media, by scientific institutions, and through the WHO Collaboration Center, and also by some technical platform like ProMed, for example. And for each information is assessed quickly. The risk assessment is done quickly, and if needed, we verify the information on proactive base with the government or the country where we think that the event is happening, to verify first, yes or no, and second, what is the important and quality information. And this is, we are doing it on a regular basis, and we are investigating more than 5,000 events per year, which is necessary the set of organization, and this is done in close collaboration by, with our country offices in 150 countries, our regional offices, and of course in headquarters in Geneva. To answer to your question, I think everybody knows that pandemic can start anytime and anywhere. This is why we need to build our detection mechanism in all countries. In all countries, and whenever we miss one country, the whole global surveillance will collapse. And this surveillance eventually contribute to the regional surveillance and the global level that we are conducting in Geneva. As Tom Frieden said, we need to also establish rapid detection of unusual events, and this detection rely on strong evidence-based surveillance system at all levels, including the subnational level. And the experience of COVID showed us that very often we have strong national systems, but these systems are not good enough at the subnational level or at the community level to detect this event. And we miss a long time between the event itself and the detection at the national level. And of course, every event should be signaled, should be verified and investigated quickly wherever it's happened. Second, we need to develop rapid investigation capacities at only at national level, but also at subnational level, including, like Tom Frieden said, through a strong laboratory network for verification. As you know, almost 75% of the emergence pathogens are from animal origin. And the hotspot of emergence are where there is high diversity of species and ecosystem interacting. Enhancing surveillance in those spots, but not only, will allow the earlier detection of containment. And this is very important. And we are, of course, in this area, we are collaborating with our sister agencies, FAO and OIE. Also, we must continue to strengthen communication and cooperation among human, animal, and environmental authorities. And this is what the One Health approach is about. Through our assessment at the country level, very often this communication doesn't exist, or sometimes there is conflict of interest on providing food to the people and protecting the public health. Of course, for disease that we don't know yet, we need to prepare. We need to prepare for the disease X at national and global level. and to have a national mechanism and global mechanism who can deal with this kind of event. And the COVID experience showed that how much important all level to not only to detect, but also to manage and control and coordinate the response. The first case of any future pandemic disease will be detected at the community and at the primary healthcare level. So we must invest strengthening early warning system, as Tom said, and alert response at the community level with the reason the community, let us say, capacity to contribute and to be actor of surveillance and alert and response, and not to be only receiving instruction how to deal and how to deal with things. And as we've seen with the COVID, it doesn't take too long time for a pandemic-prone disease to spread out the countries in which it starts. Therefore, it is not enough to rely on data from single country, rather than all country must rapidly exchanging data timely and comprehensively to allow WHO to assess properly the situation and also to propose to other countries valid risk assessment with advice on how to deal with this event. I hope that I contributed to answering this question, but I will be happy if there is any question. Over to you, Madam Chair.
Yeah, thank you very much, and also for highlighting the importance to build up capacity on a sub-national and community level. And I think this is certainly probably where Germany has its strengths, and where it was possible actually to react very quickly, also due to the kind of federal decentralized approaches and the capacities on those levels. Nana, you work in the executive office of the Secretary General on the pandemic. And you have to consider, besides of what WHO as a specialized UN agency has to take into account, you also have to consider the broader picture of the impact of the pandemic. It is affecting the life of billions of people. It jeopardizes the achievement of the Sustainable Development Goals. From your point of view, what kind of structures and alliances are needed for coordinated crisis management? Where are currently the main challenges, also from a UN perspective? And would you say that UN structures are apt and effective enough to address those challenges, especially if we want to build back better? What is needed from your point of view?
First of all, thank you so much, Andrea. And I thank the Konrad Adenauer Stiftung Foundation for convening this very important discussion today. And I'm honored to be able to speak about from a UN perspective. So we've heard already from our esteemed experts and WHO colleagues around particularly the health response and the specific foundations that need to be put in place for an effective health response to this COVID pandemic. But clearly the scale of this pandemic has also really highlighted how it has reached the lives of everybody in the world, and not only the health impacts, but also the socioeconomic and the security impacts as well. So recognizing this, we clearly need an urgent new global unity and solidarity for this COVID-19 pandemic around the world. And since the beginning of the pandemic, the UN and the UN Secretary General personally has advocated for a three-point response that brings together coordination across the health, security, socioeconomic dimensions of this crisis. First of all, a large-scale, coordinated and comprehensive health response guided by WHO and the Strategic Preparedness and Response Plan, with an emphasis on solidarity with developing countries. The UN has established international coordination and operational support at both the global, regional, and country level, and supporting particularly scaling up country preparedness and response operations. And in fact, recognizing the multi-dimensions of this crisis, the entire UN system has mobilized behind the WHO-led health response to help distribute medical supplies, train health workers, build testing and tracing capacities, prevent the spread of the virus in particular, and particularly among vulnerable populations. But also the UN has a strong focus on disseminating accurate information about prevention and containment measures, We've heard some of the concerns around misinformation and how that can undermine a response, but also particularly utilizing the huge country presence the UN has in 137 countries with UN country teams to support national responses in planning and decision making. The second prong that the SG has really been advocating for is for the UN to look at the social, economic, humanitarian, human rights dimension of this crisis. This includes the immediate humanitarian response to support the most vulnerable in the most vulnerable countries with life-saving assistance, and through the Global Humanitarian Response Plan, which was just recently updated last week, which is supporting 63 countries facing humanitarian needs and costed at over $10 billion US. And you also mentioned, Andrea, earlier on, the Secretary General called for a global ceasefire on the 23rd of March, which we've seen, you know, a very strong, has resonated very strongly with member states. So nearly 180 member states and over 20 armed movements and entities and religious leaders and NGOs and civil society organizations have really supported this global ceasefire call. But also recognizing that violence is not only in the battlefield. The Secretary General also issued a global call for ending violence against women and children, because we're seeing an increase of domestic violence, particularly with the number of people with stay-at-home orders. But at the global level, the Secretary General, particularly for the socio-economic impacts, has called for a comprehensive stimulus package amounting to at least 10% of GDP, global GDP, and also calling for massive support to developing countries in the form of across-the-board debt forgiveness, standstill, debt restructuring, and greater support for international financing institutions. This will obviously really support and help the most vulnerable populations. And then the third pillar that we've really made a strong push for is to look at how we can recover better from this COVID crisis and build back better, and that building back needs to lead to more equal, inclusive and sustainable economies and societies, which will make them stronger and more resilient in the long term. And this recovery is actually an opportunity, and that opportunity should be guided by the Sustainable Development Agenda, which the world had endorsed in 2015. So I think we need to really recognize, instead of going back to systems that were unsustainable pre-COVID, we need to make a leap into the future with clean energy, with inclusivity, and with a focus on equality. With stronger social safety nets, including achieving universal health coverage and better preparedness for health emergencies, but also building in the better preparedness for multi-hazard risks, which we also heard about previously. At the global level, the UN, we need to put in place international cooperation architecture that really is designed to address the problems and challenges of the 21st century. I think a lot of our current structures were designed at a certain period in our history, and we need to look at how to better evolve those. But fundamentally, I think the pandemic has really underscored the need for a strengthened and renewed multilateralism. We need a multilateralism which is based on the ideals and objectives enshrined in the UN Charter, and agreements that have defined them since its adoption 75 years ago. But we also need a multilateralism built on trust, and we heard about that at the beginning of this discussion. A trust that is based on international law and is geared towards overarching goals of peace and security, human rights, and sustainable development. We also need a networked multilateralism in which the UN and its agencies, the international financial institutions, the regional organizations and others work together more effectively with stronger institutional links. We often see ourselves in our own multilateral discussions and silos, whereas what we need going forward is much more stronger links across our different institutions. We also need more inclusiveness in multilateralism, drawing on the critical contributions of civil society, businesses, foundations like yourselves, the research community, local authorities, cities, and regional governments. So basically, we can really need to look towards the future and use the opportunities from this crisis to look at how we can have more effective multilateralism with the mechanisms needed to make global governance work where it's actually needed. So turning to your second question, which is what are the main challenges that we see from a UN perspective? I think the COVID crisis has really exposed and exacerbated the vulnerabilities and inequalities within and among countries, and actually really risk halting and reversing the progress that we've seen on poverty, eradication, food security, gender, education, and of course, global health that we built over the last couple of decades under the Millennium Development Goals and now into the SDGs. But we also need to recognize there is no choice between addressing the health impact and the economic and social fallout from this pandemic. This is a false dichotomy, and it's unfortunate that we do often continue to hear this. Unless we control the spread of the virus, the economy will never recover. So the pandemic and the global recession, which it has currently triggered, are causing immense human suffering around the world. So unless we act now, we could face years of depressed and disrupted economic growth. And those who suffer most will be the less equipped to respond. So together with the health response, we need to direct support that will help households, keep households afloat and businesses solvent. And this is why the SG made such a strong call for the relief packages and so that the global economy can be kept afloat, but also enable developing countries to fight the pandemic. We also, I think, this pandemic has really highlighted the fragilities that our global governance and institutions currently face. Of course, this virus is not limited only to our health systems and the fragility in our global health systems, but also the fragilities in terms of global coordinated efforts to respond to, for example, other critical challenges of our century, for example, climate change, lawlessness in cyberspace, and the still very real risk of nuclear proliferation. So because we're failing on these such critical challenges, I think we need to really reflect back and re-examine our long-standing assumptions and reconsider the approaches that we have led to such fragilities and our institutions as well that underpin those. So we must also reimagine the way nations cooperate. And I think Dr. Frieden sort of pointed to some of this. And this leads to your last question, Andrea, which is how are the UN structures and are they effective enough? And I think at this critical, this pivotal moment with COVID-19 still spreading, with geopolitical tensions rising, and the cry for racial justice, social justice, climate justice becoming ever more urgent, we have a responsibility to respond to the anxieties and fears and the hopes of people that the UN serves. And the UN structures, including WHO, can be as effective and evolve to be even more relevant for the challenges of the 21st century, as long as member states can empower them to be so. And this really goes back to the point that Tom Frieden made, which is, the UN strengths are also some of its weaknesses. The various structures such as the Security Council, the General Assembly, the Economic and Social Council could connect much wider with global audiences and develop a strengthened relationship with its subsidiary bodies and with the governing boards of UN development system entities with a clearer division of labor. Revitalized multilateralism and the various UN structures that we currently have must also ensure that its stakeholders are fully engaged and that we become much more agile and empower the representatives. so just in conclusion, I think this is the moment actually for the international community to heed the current wake-up call that COVID-19 has really brought out, and to move ahead with a collective response in unity and solidarity. Thank you.
Thank you very much, Nana, for this very elaborate response to my question, highlighting very profoundly also the multidimensional character of the current crisis and the need for member state engagement, and also the need to rethink the international cooperation architecture as such. I would like to come back now to Dr. Majur, and one point that we had touched on earlier on, when we were highlighting also the need for public trust in political decision makers. And one serious challenge for governments and also for WHO has been the spread of misinformation and fake news. And Mr. Gröhe already also mentioned it, and Nana mentioned it, because they in itself can undermine public trust and confidence in authorities if the authorities are also following the right track. But we also have seen political leaders themselves negating the seriousness or even recommending bizarre measures. How can this flood of misinformation out there in the age of digitalization be best mitigated? I know WHO has engaged in a very wide campaign to counteract fake news right from the beginning. What have been your experiences in the recent months, and what would you say has worked well in this regard? And I think you are still mute, and I would like to invite the audience to...
I think it's okay now.
Yes, perfect.
Oh, sorry, I forgot to unmute myself. No, I fully agree with you that the misinformation or the wrong information has spread quicker than the virus itself. And somebody qualified the infodemic as the tsunami of information that accompany every epidemic. And this is very, very well way to describe this problem, because in one hand you are controlling or trying to stop the spread of virus, but another way you are in charge also to stop the misinformation and to give the information. And this is exactly what we are facing these days during the fight against this pandemic, with an increased spread of misinformation. And this is becoming, let us say, quicker because of the use of the social media, where the information spread very quickly around the world and among people. Of course, this is an unavoidable situation, but can be managed, and can be managed if we take the necessary measures. First, it's required that the population has access to the right information and at the right time to protect their health during the epidemic. I think this is the key. If the population doesn't get the right information, they will look at it, and unfortunately, they will sometimes found misinformation rather than proper information. The whole issue is about changing behavior during a certain period of time to stop the transmission. And of course, when you hear your Minister of Public Health telling you to do something, and you read the media that this is wrong, we should do the opposite, then you are, let us say, in a situation that you cannot change your behavior because you don't have the right information. We know that fake news often spread when there is an information vacuum. I think if I can summarize the situation in one word, is our mandate, our role to leave no vacuum and fill every single vacuum with the right information. And this right information should come from trusted source, and everybody should contribute. It's not only the government who should give the right information. The employees should give the right information. The employees among themselves in peer process can give the right information. The faith-based organization, and we know the role of religions among the societies. The civil society should contribute. the communities themselves and through their leaders. And if we join all their effort, I think we can reach the level to combat and stop the spread of misinformation, or at least reduce the impact of the misinformation. We can ask ourselves, how would we know if we successfully or mitigated or slowed down the infodemic? I think there is two criteria. First, when the communities and individuals are empowered to be resilient against misinformation and have the skills and the self-efficiency to organize low-quality information and enact healthy behavior, and this is what the first criteria, the criteria. The second one is when will be successful when behaviors at all levels, individuals, community, society, health system, government, has shifted to resist misinformation and act. And this is, as I said in the beginning, to stop the spread of the virus and contain the epidemic. Of course, it is important to monitor the infodemic and develop control measures in real time. And WHO is developing a digital tool to do this and to monitor and quickly react and provide the right information. We are also developing a new science called infodemiology to be the position to propose evidence-based recommendation to manage the infodemics. And we just finished the global conference on epidemiology that gathered 5,000 participants from all the continent, which is by itself a very important step to establish this new approach and new science that deal with combating infodemic. In short, the right message at the right time from the right messenger through the right medium can save lives. Misinformation and mixed message can cost lives, of course. WHO, we are working with the information network that we call EpiWin, that aims to give everyone access to timely, accurate, and easy to understand advice and information from trusted source of public health event and outbreak. And this is another very important issue that I would like to highlight. Sometimes we think that we give the right information, but this information is so complex, too scientific that the people cannot digest it and can understand it. And simplifying the information is a key in communicating with the people. We are also engaging with search, social and digital companies like Facebook, Google, Twitter, TikTok, and others to filter out for false messages and to promote accurate information for credible source. And we are also connecting with some influencers who are very active in social media to help spreading the right messages to their follower, and we hope that the follower will spread them to their peers, and with that the right information is spread at least as fast as the misinformation. I will stop here. Thank you very much.
Yeah, no, thank you very much, Dr. Majur. It's really impressive to see what WHO is doing on this additional front line. And one can only say congratulations. As you said, it's really about filling this kind of information gap with the right information, with the right messenger, and also then with the kind of digestible information for the ordinary citizens. So thank you very much. I would like to come back with the last question to Hermann Gröhe, and I would like to invite also the audience to post their questions in our question and answer section, so we can take it up for the discussion afterwards. Nana already outlined the socioeconomic impact of the crisis and what we are facing, particularly when it comes to the reversal of the achievements in the context of the SDGs. But I think as a politician, you are also constantly under this kind of tension to balance off public health with economic affairs and development. And here in the US, when we see the tremendous spike in cases, particularly in those states which opened their economies and loosened the lockdown very early on, you can see the kind of struggle of political decision makers. What would you also now say particularly with the experience Germany has going through, what have been the kind of guiding principles that worked well and which could be also then recommended to others?
First of all, thank you very much. Of course, we have to balance out different aims, but following Nana's word on the whole picture, that there are a lot of pieces in that mosaic, I don't see a contradiction between public health and social and economic development, not in peacetime and not in a pandemic crisis. In peacetime, we should not see health expenditure first as costs, but as investment in human resources. There is no lasting social and economic progress without health cover, universal health coverage. Of course, we should give countries advice or recommendation to spend money in the health sector in an effective way, because resources will always be limited. But it's not good, and I'm happy that the World Bank is now much more pushing in favor of investment in health system strengthening, that investing in healthcare system strengthening means investing in the foundation of economic and social progress. And that's the same in a situation of a pandemic crisis. Again, I would refer to Tom Frieden. If you postpone restriction to save your economy, it will bring the costs very soon, dramatically on the human side with increasing infection and death rates, but also countries that were in the beginning very reluctant against restriction had to go with very hard restriction later on, and had on the same time hard damages in their economic situation. So I believe that it's all about speed. Again, Tom said that it's about speed. If you start with restriction, we did that very early in Germany, and now we have the situation that we have regional or local hotspots where you can do regionalized limited restriction, and not anymore all on the national level or on the state level. But it started with stricter restrictions, and this was supported by local health authorities, lab capacities, and so on. And let me add, again, following the WHO and the UN perspective, another balance. That's a question of the costs of international solidarity. Because we are in a time where a lot of people think my country first. Germany has increased its contribution to WHO quite dramatically, now about 500 million euro. And I applaud to that decision made by Angela Merkel and my successor Jens Spahn very much. On the same time, I have to remind my countrymen, fellow countrymen, if they are criticizing that, we spent now 500 million euro this year for WHO. But this Monday, this very single day, just our public health insurance will spend more than 500 million euro. Every day of this year, 365 times more than 500 million euro. And we have to add private insurance and so on and so on. So if we talk about the costs of international solidarity, we should keep in mind the picture of the sprinkler system in every room. We cannot save our flat in the common house without saving the whole building. So I'm convinced that there is no contradiction in protecting your own population. And that, again, is not only when it comes to a pandemic. Let's talk about AMR, antimicrobial resistance. We can do whatever we want in Germany. If it's not embedded in international efforts all around the globe, it will fail. Whatever we do, we need local steps, we need national steps. But if we fail in putting them into an international global frame, everything will fail what we are doing on our national level. So solidarity is not an add-on, a luxury thing done after you have done your homework, but it's a precondition for making your homework proper.
No, thank you very much for this very vivid plaidoyer for also multilateral engagement, which to all of us at Konrad Adenauer Foundation is very dear to our heart. I would like to open the floor now for the question and answer and discussion session. And I can see a couple of questions. Then I would like to relate one to Dr. Majur, which comes from Karen Ghosh, who would like to know what kind of role can regional organizations such as ASEAN, ECOWAS, or even the EU play as a kind of a linkage between global and national pandemic preparedness and response?
This is an extremely important question, and in my answer to your previous question, I forgot to highlight the importance of the role of the regional level. I think they have a key role to play. First, in terms of providing technical assistance to the countries, because they are more close to the reality of the countries of the region. They are aware about the cultural aspect of the country, and their advice or their support to this country could be very close to the specificity of the country, and then have a great chance to be implemented and get results on the field. The second also, I would like to mention the role of the regional banks in supporting the country of their regions. And we have ASEAN, we have African Development Bank, we have the Islamic Development Bank, and all these banks, they have an agenda on health. They should work closely with the WHO regional offices to tailor their support to the real needs of the countries. And to summarize my answer, yes, they have a huge role to play, and we are developing something that we call the emergency medical teams. And the emergency medical teams are divided in two levels. The emergency medical team for the country level, who are the first responder to any emergency. We are also developing regional capacity, or where emergency medical teams from country A can support country B, and I said that this is sometimes more fruitful. And of course, we have global emergencies medical team who can be deployed first to big event, and also to provide highly sophisticated response when this response is not available at the country or at the region. And this is how I see personally the role of the regional institution in complementarity of the national level and the global level, and sometimes making the bridge between both levels.
Okay, thank you very much. I have another question for Nana, which comes from Abdel Diop from IOM. He would like to know what kind of relevance play the recent reforms in the UN system, particularly the establishment of the resident coordinators, the UN country teams. What kind of role do they play now in the current crisis?
Thank you for that question. I think what we've seen is the UN reform that have been implemented have actually really come into effect and really shown how they have really stepped up and become much more effective. So as I mentioned, the socioeconomic impact area of work, it was through the UN reform structures that we actually developed a strong, coordinated and integrated socioeconomic framework, which is the framework which country teams right now are using to better support countries in their COVID response, but also deal with the immediate socioeconomic response and recovery plans. So we're actually seeing the fruits of that reform come forward and come to play with much stronger coordinated inputs from across the UN system, and leveraging the different agencies' capacities and putting them forward to support country responses. I saw that in the question they specifically asked about the the UN network for migration as well. Obviously, the issues around migration and migrant rights have really come to the fore as well, particularly the issues around lack of access to adequate health services in countries when they don't have legal status, or in fact, the closing down of borders has prevented certain other kinds of migration, the economic migration or seasonal migration and that underpins a lot of our food systems and our economies. And where we again see is the system coming together to really put forward the issues, the evidence and the issues around these most vulnerable populations, so that we can advocate much more strongly as a whole system together. The network itself, I think, has been effective in supporting particularly certain regions. We've seen them asked to support particularly the Latin America region, where we are seeing a lot of people on the move, populations on the move or displaced. So overall, I would say the reforms have really shown their effectiveness through this crisis response.
Thank you, Nana. I have another one dedicated to you, and it reads, why did the UN not take any action when the United States started to blame China, as it also jeopardized the work of healthcare workers?
So I think Dr. Freeman pointed out some of the difficulties that we face as the UN in calling out particular countries. But I think we worked based on the principle of transparency and openness and evidence base, and bringing forward all of the data and evidence and working together with all member states. But also recognizing the need to reflect back at the right time around the COVID response overall from the UN system, but also ideally also for countries to reflect on their own responses. And this recognition was recognized at the World Health Assembly through the World Health Assembly resolution in May, which they did adopt and requested an independent investigation into the COVID-19 response. So we need, I think it is in the interest of all member states and countries and the UN system to support a really rigorous and independent review, but we have to make sure that it comes at the right time as well, because right now we are still very much in the midst of an emergency response to this COVID. It certainly has not been, the pandemic has not been controlled around the world, and an investigation should not detract from that emergency response.
Thank you, Nana. I have one question that refers back to the differences between actions in the Security Council during the Ebola crisis and now on COVID-19. I'm not sure who feels comfortable of our panelists to respond to it. What has been the kind of difference in the situation that in 2015 we had a resolution, we had a medical mission, but now it took months to come up with a resolution. Mr. Gröhe, would you like to answer?
Of course, we were disappointed how long it takes to give a clear Security Council position to that. We saw in the Ebola crisis after a shock, and in the beginning, of course, also misunderstanding about a lack of transparency in the beginning, and so on, that then to the highest level of politicians in the G7, in the whole UN system, and wherever there was a unity, we should act properly, we should act multilaterally, and we should have then also an independent evaluation, what we did after the Ebola crisis too. And this time we see, of course, that this is echoing the situation of the situation at all in the Security Council. Of course, Germany is now looking very strong on what's going on there in that most important body of the UN system because of our chairpersonship. And if you see how long it took to make some progress, and small progress, too small progress on the humanitarian crisis for internal refugees in Syria and all the other things. There is a lot of blockade, and we should now end any blame game saying who started in blocking whom, but we need to see that this is really a global threat that nobody can answer alone, and not a region, but that shows very clearly if there is not a common answer, there will be no effective answer at all. And so it's sad to say that, but the postponement of a decision in the Security Council echoed the situation in the Council at all. And this is a common responsibility of all members to strengthen. Again, it was said during this debate today and in other public debates, you can criticize multilateralism for a lot of failure. But if you do that honestly, in the end, you have to strengthen multilateralism. You cannot criticize it honestly without proper funding, without independence, strengthen transparency. And I think, of course, there are good reasons to make some questions about the situation after the first outbreak in China and so on. And there will be this needed independent evaluation, but it was hard to see how long it took this United Nations Security Council to act.
Thank you very much. I have another question from Wesley Ward from the University of Ottawa, going to Dr. Majur. He would like to know how well actually the system worked, the complementary media scanning in addition to the official reporting of member states to WHO. How efficient did this work, your own knowledge, when the outbreak in China started?
This is a very, very important question, and as I mentioned, WHO is have a system in which collaborate several partners, and this system is called Epidemic Intelligence from Open Source, where we look to the information published in the media, information public, as I said, through our collaborating centers, through the specialized institutions, and also information coming from our country offices, because we have 150 country offices in countries who are screening local media, local information, and reporting and analyzing the situation. Of course, not all this information that are covered by this network are very important information to be assessed, let us say. For example, if there is a media report on one case of of cholera in a region that very well known and where cholera is endemic, this is not important information to spend time on to assess, because it's known and there is action on the field and it's not a surprise. But what we focus on is unusual information. Unusual mean for us, it is unusual because never been seen before, and this is the case of COVID or before the MERS and before the SARS, is unusual by its size. We used to have 2 or 3 cases, and now we have 3,000 cases in one shot. And also unusual, but is a localization. If country never had polio and suddenly there is a case of polio, this attract our attention. On top of that, we have some disease for which we have specialized system like polio, as I mentioned, like the influenza, for example. We have GCRS, which is a global network that collects information. And we have a dedicated team who look to all this information, do risk assessment. And as I said in my first intervention, we are assessing more than 5,000 events per year, which is a huge work. And when we have something that we need verification, we use the IHR and we write officially to the state party to ask for verification and confirming or not confirming the event. And this is where the collaboration with the country started. For example, for the COVID, we had the same day notification from China and also notification from ProMed in the same day, which is confirmed the same, let's say, event through different mechanisms. And this gave, of course, some kind of validity and accuracy to the event itself because it's coming from two reliable sources. This is in summary, but I will invite our colleague to go to our website and can send more information about what I said. Thank you very much.
Okay, thank you, Dr. Majur. And actually, I have one comment. It's not a question, it's a comment by my colleague, Olaf Winczek from the CAS office in Geneva, who highlights also the readiness of Germany to take leadership in the WHO reform process and also with the idea to come up with proposals. And he considers that it's crucial that this reform process is really started rather sooner than later, as now it's the window of opportunity, and he would like to encourage you, and perhaps we can also then have a discussion around that topic together with CAS Geneva at a later stage. I would like to close this discussion with a question from the German mission in Geneva, from Mr. Brombeis, who highlights the necessity to continue with this discussion on the nexus of health and security. Also now during the presidency in the Security Council, Germany also hosted an open debate on pandemics and security. And he also underlines the necessity to keep the debate. And he would like to know, and I would like to pose this question to all of you, how can we really make sure that this is not now just an effect of the crisis, so that we are really continuing with the debate on global health, which also then might increase investment in WHO and pandemic preparedness. Perhaps, I'm not sure who would like to start. Nana, ladies first, perhaps. You are still muted.
Sorry, this is an excellent question. I thank the colleagues in Geneva. I think we have to take advantage of this crisis and really ensure that the world is better prepared to deal with these nexus issues around health, security, socioeconomic impacts, and human rights in a much more holistic way. And I think this also goes to the heart of some of the UN reform efforts. And we should probably look at what elements need to be more have a dedicated discussion in New York versus those issues that are left to Geneva for particularly the technical health, public health related discussions. Because we have to recognize this requires a whole of government leadership to ensure that these nexus issues are taken seriously and continued and don't just reappear when an emergency happens. So the questions, it's wonderful to have Germany's leadership in the Security Council, where I've been talking with your colleagues in the New York mission about how we can better integrate some of the global health security issues into the Security Council, but also how can we best take advantage of the number of GA-related high-level discussions and resolutions that we're seeing emerge this year. Of course, we had a number earlier this year, but we now have an omnibus resolution, and we have the UN General Assembly coming up in a couple of months. And this is where heads of state and government need to take up these issues and ensure that they don't drop off. I've worked on global health for many years, and for the first time through this crisis, I'm seeing it taken up across the board at a head of state level. So how can we create the right mechanisms and structures to ensure, for example, the G20 continue these discussions? I know through Germany's leadership of the G20 a number of years ago, global health was put on the agenda. But then, and it was very much integrated into the finance track discussions, but subsequent G20 discussions actually, relegated health again back to either a standalone siloed health health pillar or at best into the development work stream. So how can we utilize all of our different multilateral mechanisms to ensure health and security nexus issues are discussed at the highest level? Thank you.
And perhaps I would like to add on a last question that just came in now. How can we ensure that health has or becomes a kind of a cross-cutting issue in other policy areas as well, if we try to strengthen this link and the nexus of health and security? I would perhaps, Dr. Major, you would like to come in, and then the final word goes to Mr. Grue.
This is extremely important question, and if I personally would like to take one lesson learned from this experience of the COVID-19 is that intersectorial collaboration is not enough. What we need to look in the future is the whole society approach. Individuals have role, communities have role, civil society have role. Of course, the governments have a role to play. And if we can mobilize the whole society to be prepared and to contribute when something happens, this will be extremely important for our future, let us say, response to pandemic. If I would like to just to respond in one word, is the whole of society approach is a key. And we saw it in many countries where every single individual contributed to fight against COVID by using their expertise, using their shops, preparing food for nurses and physicians. And this is what was a beautiful thing to what we need to keep. But the whole of society is a good slogan, but it should be used in the preparation phase, in the peacetime process, to be count on it on when an event happens. Thank you.
Thank you, Dr. Major. Mr. Grue?
First of all, a crisis, a wake-up call, like a pandemic, is of course a moment to learn something. And that's why it's so important that we have such an independent evaluation. On the other side, we need to make these issues lasting points high on the agenda, nationally and internationally. And if it was said that we need a society, all sectors of society approach, the roadmap are the SDGs. If we take them seriously, we know that SDG 3 cannot be excluded to its best or to its worst. You need to see all the aims, all the targets and the Sustainable Development Goals to have human, social, and economic progress. So taking this roadmap serious is one of the answers. The other thing is to make it a lasting issue, lasting point of our national agenda. We have now a subcommittee in the German Parliament on global health, so that we have regularly debates, not only if a crisis is there, but about the global health situation. There is now a continuous debate in the German Parliament. There is now a process of reconstructing the Department of Development Cooperation, and there will be a new subdivision on global health and One Health approach. Dr. Major pointed out the importance of zoonotic origins of a lot of those diseases. So the One Health approach is very much to underline. And let me now switch to the head of the deputy chair of the Konrad Adenauer Foundation. After opening the office of Andrea Ostheimer in New York City, the United Nations capital, we are now represented in Geneva. Olaf Finzek is joining us. We are then in Vienna, and we hope we can soon, if COVID-19 is in the box, we can open our office in Addis Ababa, the seat of the African Union. We do that as political foundation also to strengthen the visibility of multilateralism in national debates, to support on the one side these international institutions and the people working there in New York, in Vienna, in Geneva, and hopefully soon in Addis Ababa, but at the same time to contribute to the activities of, through the activities of the Konrad Adenauer Foundation in Berlin and throughout the country, to strengthen the visibility of multilateralism and its institutions, also if there is no crisis. So I think it needs to have lasting efforts, and I promise you the Konrad Adenauer Foundation will what we can do in that field. We will do what we can do in that field.
Thank you very much for this final word, Mr. Gröhe. I can only now say a very, very warm thank you to all the panelists. It has been an extremely enriching discussion, touching on many issues, but with a lot of also expertise and also technical knowledge that we were able to transfer to our participants. And I would like to thank all participants from all over the world. And I've seen you even had participants from South Africa tuning in. And it's, as it is in Europe, also already quite late there. So I thank everybody for your interest in the topic, for sharing your knowledge and your expertise. And as Mr. Gröhe said, for us as Konrad Adenauer Foundation, it's really the objective to strengthen multilateralism. And I always also in other contexts say the multilateralism of the 21st century also has to move away from this mere intergovernmental approach. It has to encompass this whole of society approach, and it has to work with civil society, but also with the private sector. So I'm really looking forward to continue this discussion on other occasions. I wish you all the best, and thanks once again.